president signed an executive order setting a 30-day deadline for drug makers to lower the cost of prescription drugs and asked his top health officials to meet with pharmaceutical companies to broker a deal.
If they fail to do so, President Trump says his administration will tie what Medicare pays for some medications to the lowest price paid by other developed countries.
Some prescription drug and pharmaceutical prices will be reduced almost immediately by 50 to 80 to 90%. Big Pharma will either abide by this principle voluntarily or will use the power of the federal government to ensure that we are paying the same price as other countries.
Some pharmaceutical organizations released statements opposing the executive order, calling it a step towards socialized medicine and saying it was negatively impact the drug research.
Now, it didn't take long to find Rhode Islanders today who welcome the possibility of cheaper prescriptions, many impacted by high costs personally. Our Sheena Losciuto is live in Providence with their stories. Sheena?
When we spoke to people today, both on camera and off camera, a lot of them thought about their family members as well. The most important detail to them is that Americans have the access to the medications and health care they need. The price of prescriptions?
Some of the medications, as I say, are a couple of $100 a month per bottle for a month.
Add up time and time again.
And there's nothing I can do about it. I mean, my doctors prescribe them. I know I have the diagnoses that indicate the use of that medicine for that condition.
All over $200-some a month.
So it adds up.
A lot.
That's why many are waiting for more details after President Trump signed an executive order this morning aiming to help your wallets, ordering drug makers to lower the cost of prescription drugs, setting a 30-day deadline. If a deal can't be reached, the order aims to kick in a new rule. The U.S. pays the lower prices paid by other countries. A retired doctor himself, Bruce Hookway, says there's no simple equation when looking at what the White House is aiming to do, so he'll be keeping an eye on what comes next.
My opinion that this president likes to do things that sound big and splashy, and when you get down to the details, you find out that it generally benefits the big pharma and big insurance at the cost of the private payer.
The exact impacts are unclear as officials negotiate over the next month. The order also has the support of the commissioner of the FDA.
I've been a surgical oncologist at Johns Hopkins for 22 years, and I have seen patients suffer. We didn't take an oath to heal patients and then watch their life get ruined financially.
So this is very early in all of this, but we did reach out to the Rhode Island Department of Health today to get their take on it. We're still waiting to hear back from a statement. Reporting live in Providence, I'm Sheena Losciuto, 12 News.